Hi there, and welcome back to Sparks, a spotlight series from the Boost community. Today we welcome Ismaila Ibrahim Edego, an immunization expert who specializes in vaccine campaigns that reach underserved communities across Kaduna State, Nigeria. Edego joins us today to discuss some of his experiences conducting community sensitization sessions, including consistent challenges that arise through these dialogues. Keep listening to learn how Edego applies his skills to improve service delivery, vaccine acceptance, and trust between remote communities and the local government.
My name is Ismaila Ibrahim, currently located in Kaduna State, Nigeria. I'm a trained immunization expert in community dialogue through demand creation and resolving vaccine hesitancy among individuals during supplementary immunization activities, that is SIA campaigns. I work as a local government officer to support the planning, organizing, and then implementing core activities to make sure that every child, regardless of geographical area, are vaccinated, especially those in the rural communities, nomadic communities, and those people around border with other countries. Before implementation, there are social mobilization activities that we perform as a team, including other partners and the LGA team. First, for the people that are going to do the work, they have to be sorted from each community for ease of work. Then you can only conduct one community dialogue and sensitization per day with the team that you are going to go to that settlement. We plan for the number of settlements on different days to ensure that we have enough personnel and partners that will be able to conduct such community dialogues before the day of implementation. It's not something that we conduct in a day. It's something that we plan out based on the resources we have on ground. Secondly, we meet with the community leaders. We try to find out what the reasons for their rejection, whatever information they bring, we incorporate into our plan before implementation. Then we ensure that we sensitize them regarding the location, the time, the days in which each settlement will be visited with services, and while those services are going on. As time goes on, you see different circumstances that lead to vaccine hesitancy. If I'm to give you an example, there is one settlement that was rejecting the vaccine. So when I came on board, all avenues have been explored. To others, this could well be the end of the matter. Reaching the settlement, I inquired for the community leader and was told he went to his farm located just around the settlement. As someone from a long line of traditional rulers, I know how potent traditional respects are when dealing with royalty. I made sure to adapt to the settlement's unique approach. After the traditional pleasantries, I introduced myself and my mission, where I made it clear that I was there to see how the settlements would be vaccinated. To this end, I respectfully requested him to help mobilize all available community members, including the youth and women, for a possible discussion on the issue of vaccination. Eventually, the leader obliged, but not before quizzing me to know, where are you from again? I replied that I'm from Esther, posted to ensure that all eligible under 5 children in the LGA are vaccinated. So I want to find out their reason for refusing vaccination of their children. After some period of silent discussion, someone in the crowd stood up to declare that they own their children and no one can force them to take any vaccination, which they don't trust. I said, he's right. They were taken aback by my frankness because the looks on their faces changed from skepticism to incredulity. I turned around and addressed the committee leader. Baba, I began, have you ever been vaccinated before? He raised his shirt to show me his vaccination scar. I turned to all the elderly men in the gathering, and they all showed me their vaccination scars. One stood up to show me the scars of smallpox on his face. I said, Baba, I'm very young, but history shows that you were all vaccinated against disease outbreaks of your time. But here we are in the era where you, the leader, is denying your children and grandchildren the opportunity to get vaccinated against polio outbreak of their generation. I said, disease will still be around if not for immunization. After my explanations, in no time, myself and my colleagues were vaccinating on the 5 children. We were overwhelmed by the wave of acceptance as families rushed to get their children immunized. By the time we were done, over 85% of the children have been vaccinated. One of the youth stood up and said they have been marginalized. They have never enjoyed free treatment for minor illness. He highlighted the problem of lack of drugs in the health facilities, absence of electricity, and other basic amenities. Why then is it that government is determined to force polio on them? Why then should they bother about anything else coming from the government or not view the polio vaccine with suspicion? In some states, you will find that issue of insecurity, poverty, unemployment, poor infrastructure development in these areas is creating agitation between the people and the government. Hence, any vaccine from the government is seen as something suspicious. These people will tell you what they need is not vaccination, but what infrastructure, food, and agricultural support. But right now, we are working very hard to ensure that we change that narrative. I told them that as health workers, we are not politicians. We have to go out, do our work, and ensuring that people are prevented from contracting diseases. I advise them to form a good political youth group as a tool for achieving good rapport with government. There are communities where they are inaccessible. For example, some of these communities do not have a network. The communication gap between the settlement and the program manager is always an issue. In trying to reach the community leader, sometimes you have to send somebody there, sometimes even 40 kilometers to get to those places. Some you need the presence of the community leaders to access, sometimes because there are so many settlements, the resources on ground cannot meet up to ensure that everywhere is reached. We prioritize settlements that have more issues and more population, and then we deal with it before shifting our attention to other places. Some of the challenges we find is their health facilities. Where health facility is manned by only one personnel who is conducting all primary healthcare activities, including immunization. So sometimes the people are overwhelmed. Then you see issue of gender come up in some cases where the facility it is a hard to reach facility and they post a male personnel there. You see that in the community, because there is no female staff in that health facility, they will not access services because they will not want to expose their daughters and wives to a stranger. You see, some of the dialogue, we made it clear to them that the only way they can help the health worker is to get a female volunteer among them. The success of any immunization program hinges on well-planned and executed community-based dialogue, sensitizations, and robust negotiations, when implemented, will go a long way in improving and strengthening primary healthcare services and immunization. The best way to get to the root of problems must involve a face-to-face meeting with the people to get first-hand information, even if just to cross-reference with available data. You need to put yourself in their position to see things their way and explaining why they need to adjust or change their ways for the benefit of good health through a trusted primary health care and immunization service delivery. This, I believe, is the right approach that will steer one to the right path of solving present issues, especially vaccine hesitancy.